This is Dr. Siddharth Sethi, your pediatrics faculty and a pediatric nephrologist by profession. Today, I'll be discussing with you a very important topic for NEET PG. And in fact, this question came last year in your NEET PG 2019. The question is on Fragile X. Which of the following statement is true regarding Fragile X? What are the kinds of repeats? What is the percentage of affection in females? What is the average IQ of males with Fragile X? And what is the kind of mutation in Fragile X? Now, now, please note that the chromatin condensation, especially at the XQ27.3 locus, very important for all of you, XQ27.3 locus, because of multiple repeats of CGG. Remember, it is an X-linked dominant syndrome. Now, what happens in this FMR1 gene is that on the 5' site of this gene, there is increased methylation of the cytosine. Just remember, students, there is increased methylation of the cytosine. This leads to silencing of the gene. Just remember, it leads to silencing of the gene, which leads to all of the problems. In normal individuals, the repeats of CGG are less than 50, but in patients with Fragile X, the boys, the repeats are more than 200. Oops, you have seen a boy with Fragile X in a very popular movie. Remember the years. Remember that as the children grow, you will see the problems. You may not see the typical phase in an infant. Infants may just have GER, poor sick, but as they grow, you will see more and more of attention deficit hyperactive disorders in these children, impulsiveness, aggression, and even autistic behavior. So remember, most of them will present to you with ADHD kind of features, followed by autism. Now remember, especially boys who have CGG repeats which are more than 200, the mean IQ is usually less than 40. Mean IQ is never more than 50. Okay. Now remember, most of them present with ADHD kind of features, rarely autism. Now, females have less than 200 repeats. They do not have the behavioral problems or the IQ, the intellectual problems. And in fact, females have more of premature ovarian failure or an early menopause, which is seen in Fragile X syndrome. So remember, it's an X linked dominant syndrome, more common in boys as compared to females. So, coming back to the question, remember that males have usually an IQ less than 55. These are CGG repeats. More are the repeats, more is the mental retardation, and that is why you see the typical anticipation in these patients. With increased generations, with the progressive generations, you will see that the severity of the disorder becomes more prominent and it presents early. Females are rarely affected. They do not have mental retardation most of the times. It's a loss of the function mutation, remember. This was Dr. Siddharth Sethi, and I'll be in touch with you regarding pediatrics. And I'm always there on the club to answer all of your queries. Thank you.